A wisdom tooth is something that a lot of people tend to look over. However, a single wisdom tooth can cause many problems within the mouth. The most common of these problems is an infection of the area. This can impact not only the wisdom tooth, but also the teeth around it. Other common problems may include pericoronitis, periodontal defects in the distal aspect of the third and second molar, caries of the third and second molar, different types of cyst and odontogenic tumors, and neurogenic pain. Each of these problems are more likely to occur with the presence of wisdom teeth, so don't let pain and infections worry you. Prevent the problem before it even happens. Wisdom teeth extraction is the most commonly performed oral surgery in the United States. Prophylactic removal of asymptomatic wisdom teeth are most frequent in patients between the ages of 14 and 30. Prophylactic removal of the wisdom teeth in younger patients should be performed once pathology is diagnosed or even earlier to help prevent any pain or infection to the patient. Older patients subjected to wisdom teeth removal are at greater risk of developing post-operative morbidity than younger subjects. It would be wise to get your wisdom teeth removed as early as possible so that you, your children, or other family members will never have to suffer from the problems that can be caused from having wisdom teeth. Before the actual procedure of surgically extracting your wisdom teeth, consider intravenous sedation. IV sedation allows a combination of sedative and narcotic drug administration to safely and effectively allow you to sleep through the entire appointment. IV sedation allows patients to undergo the surgical procedure without anxiety or discomfort. Many patients will not even remember the whole procedure, only bits and pieces from a dreamlike state. As we have mentioned, surgical extractions of wisdom teeth are a very common procedure. However, common procedures do not come without minor risks and, of course, the risk of complications. Before the procedure, an experienced dentist will conduct a full preoperative exam to ensure that the conditions are optimal for surgery. If there are no complications during the procedure, surgical extractions of wisdom teeth are relatively quick and painless. To remove all 4 wisdom teeth without complications, a procedure can be finished within 1 hour. One of the most common complications of all surgeries is post-operative bleeding. Post-operative bleeding from dental extractions is commonly due to blood from nutrient blood vessels in the supporting bone, but can also be due to an arterial source. Patient factors can also contribute to excessive and prolonged post-operative bleeding. Patients who are on medications such as Coumadin, aspirin, Plavix, and chemotherapeutic agents may have prolonged bleeding. To control the bleeding, take a 2-inch by 2-inch gauze dressing, fold it, and place it into the socket. Then bite down firmly on the gauze for at least 15 minutes. It is also advised to sit upright to decrease the pressure in the head and the neck area. Signs and symptoms of hypertension such as dizziness, shortness of breath, pallor, and tachycardia should always be assessed if there has been evidence of profuse bleeding. Post-operative soft tissue swelling can be a normal part of the healing process, particularly during surgical extractions of the third molars. The removal of bone and the elevation of periostem can cause significant swelling in the post-operative period. This swelling will increase throughout the first 3 to 4 post-operative days. Surgical swelling should slowly diminish from post-operative day 3 or 4 until it finally disappears by day 7 or 10. Some post-operative complications of surgical extractions may include dry sockets. A dry socket is a delayed healing of the alveolar bone after a dental extraction. It is usually diagnosed on post-operative 3 to 5 days when pain suddenly intensifies and instead of gradually decreasing, it gets worse. It is associated with throbbing pain and a distinctive foul odor from the wound. Another possible post-operative complication is sinus perforation. The maxillary sinus is a potential source of complications during the extractions of upper molars. Patients are advised against creating suction by smoking or sucking on straws. Heavy sneezing or forcefully blowing through the nose should be suppressed. Other possible complications resulting from oral surgery include, but are not limited to, root tip and maxillary sinus, as well as a nerve injury. Before you leave the clinic, post-surgical written instructions will be given to you. Your post-surgical appointment will be scheduled as well. Post-surgical checkup appointments are highly recommended to ensure that there are no complications or side effects from your dental procedure. Prescriptions such as Loratab will be given for pain and amoxicillin will be given as an antibiotic. If you have any questions, concerns, or unusual pain associated with the surgical procedure, please call the clinic. We will be happy to help you in any way possible.